Welcome to Rajendra Tandon videos. We take up a few problems relating to the digestive system. The first one, which is a serious problem, is hepatitis. It's an inflammation of the liver. It can be acute or chronic. The symptoms are a severe loss of appetite, nausea and vomiting, headache, pain in the joints, a general feeling of being ill, fever. As jaundice develops, the patient passes dark urine and a light colored stool. Now these are symptoms which can't be missed. Everything is yellow about the patient. Jaundice fades after 2 to 4 weeks. At times it may take months. Relapse occurs often in hepatitis. Complications can result in cirrhosis of the liver and scarring. Liver failure can lead to death. Seek medical advice as soon as hepatitis is detected. The medicines, as discussed below, will positively help. The patient must compulsorily rest in bed, take a diet high in calories, low in proteins and free of fats. Diet plays a very important part in curing hepatitis. The patient's saliva, urine and stool is infective. Take precautions if someone has to handle the patient's bedpans or clothes. When the skin is yellow, wilted, cold, clammy, eyes are dirty yellow, tongue is yellow, urine copious yellow, foamy, stool is bright and pasty, liver is enlarged. There is constant pain under the inferior angle of the right scapula, the bone near the shoulders. Chelidonium 30 is prescribed, Chelidonium 30. It has to be taken for quite a few days, maybe 2 weeks. The other medicine is Chionanthus, Chionanthus 30. Chronic swelling of the liver with jaundice, constipation, no appetite, liver painful to touch, skin, tongue, stool yellow, urine dark. It's a very specific symptoms. Urine dark, bile in urine. When the liver is enlarged and tender with profuse anemia, skin ever moist and itching, deficient bile secretion, use Merc-Sol, MERC-SOL 200. Cirrhosis caused by excessive intake of liquor requires Nux vomica 200. If cirrhosis has been disseminated through blood, the liver is sore, generated with fat deposits, congested, large yellow spots on the abdomen, very clear-cut symptom. Phosphorus 200 comes in. I now take up different types of hernias. Hernia is a protrusion of a part of the body, limbs, through a gap, through a hole in the nearby part of the body. Femoral hernia is common in women. A cherry-sized bulge grows below the middle of the groin crease. It's an unmistakable symptom. The patient would notice it immediately. We prescribe plumbum met, PLUM MET 30 for strangulated femoral hernia. Mind you, the placing is middle of the groin crease. It's a visible thing, a visible part of the body, and any patient can see it for herself or himself. The next one is a very frequent hernia called hiatus hernia. It's a protrusion of a portion of the stomach through a rupture in the diaphragm. Its symptoms are unmistakable. There is severe unbearable pain beyond the breastbone, often after a meal. Pain radiates in all directions from its center, worsened by tight clothing around the waist and sitting, bending forward for any reason after having food. Cutting heartburn because acid and semi-digested food spills up into the esophagus. At times, these symptoms can be confused with a heart attack. A proper diagnosis is essential. Talk to a doctor if necessary. The most effective medicine for hiatus hernia is Argentine nitricum 200. It relieves the pain, heals that part of the body, and avoids surgery. Take over a few days. It's almost a cure. I have tried it on myself and others. It has never failed. The patient ought to change his eating habits. He has to cut down on fried food, alcohol, tobacco or coffee. He must avoid bending forward while working at an office table or before a computer or while driving a car. An hour must pass before he lies down after a meal. He should avoid wearing tight clothes around his waist. Inguinal hernia is a protrusion of intestines or other contents of the abdomen through a gap in the groin. Normally surgery is done. The hernia is pushed back. The intestines are pushed back. The gap is sealed either with sutures or by placing a plastic web. The symptoms are swelling in the groin or scrotum, pain. Most of the time surgery is the only way out, but you can try Calcarea carb 30, and for hernia of the right side, Lycopodium 1000, one dose every week. The stomach is distended, there are rumbling sounds. On the left side, Nux vomica 1000, one dose every week. But most likely the patient would have to undergo surgery. The last item in today's video is umbilical hernia. It's a round swelling near the navel. Babies suffer from it. Aurum Met 200 would help in umbilical hernia in babies. AURUM MET 200. An alternative medicine is Calcarea carb 30. Umbilical hernia itself is a symptom, so no other symptom need to be studied. If you listen to the video carefully, apply your mind to the symptoms as discussed for various medicines, you should be able to select your remedy and get relief. Thank you for listening to me, for visiting this site. We shall meet again. Bye-bye.